here today with yourpregnancy-doctor.com to find out a little bit more about stem cells, what they can be used for, and should patients consider storing them following the birth of their babies. Hi Shamshad.
Hello.
Thanks a lot for inviting me down here today to find out a bit more about stem cells. What inspired you to start Smart Cells International?
Well, in my previous life, I was in the world of clinical research, and we were doing drug trials for pharmaceutical companies, primarily in the phase 1 and phase 2 area. Whilst I was involved in that business, I came across stem cells, and you're going back to the late 90s now. And I was very intrigued as to what the potential of stem cells could be. And then when I eventually sold some parts of my clinical research business back in 2000, obviously I thought, what shall I do next? And then I did some research and I found there were some US companies offering expectant parents the opportunity to store their newborn baby stem cells for potential future use. So I decided to duplicate the model and I brought it over here to the UK.
And tell us a little bit about Smart Cells.
Well, Smart Cells is a company that I founded back in, well, it was incorporated in July 2000, and in fact our first sample was collected on February the 6th, 2001. And it was, initially I set up the business in the UK, and then I soon realized that in order to get any sort of penetration, I'd have to expand the business into other markets. So we set up an office in Dubai, in South Africa, and also in Hong Kong. And then slowly, the business started to evolve, and we gradually got more and more samples. Since then, we set up our own laboratory here near Heathrow Airport about 10 years ago. This allows us to collect samples from all over the world, because currently we have offices, our own offices in 3 countries, and we have partner offices in about 10 plus countries as well. Although, interestingly enough, we have collected from over 70 countries around the world. Right. So people are sending us samples from everywhere.
So a real international business.
It is, yes. Yeah.
And so that's why you're next to Heathrow, so
absolutely
reduce the transportation
that's
time.
right, yeah, because we have got a certain length of time we would like to get our samples processed by, so this helps being near to Heathrow.
And why would you recommend potential parents store their cord blood or tissue?
Well, when I first started Smart Cells, we advised parents that the cord blood is a great source of stem cells. The placenta and the umbilical cord is a discarded tissue. So you're throwing away the opportunity of something that could be very valuable. And I'm pleased to say that to date now, I mean, there's something like over 40,000 transplants have been done worldwide using cord blood. So the issue of whether or not they can be used for transplantation is no longer an issue. Also, as a company, we've also now done 20 transplants. But what's been interesting in that, at the time, it was accepted that the stem cells could be used for what you call various blood-related illnesses or genetic disorders, such as certain cancers or things like thalassemia or sickle cell. But recently, we have been releasing more and more samples for neurological disorders, such as cerebral palsy, and also we released our first sample for autism. So the statement that I made almost 18 years ago, that you never know what you can use these stem cells for, may be coming true.
And you say you collect from countries outside the UK?
Yes. Yes.
And over 70 of them, you were saying?
Well, yes, we haven't got presence in 70 countries. We've probably got a presence in just over 10 countries. But, it's a case of your sister living in Australia finds out about it and wants to send her baby stem cells to us. So that's another country.
Well, that must pose some amazing logistical problems.
Exactly.
And do you collect from NHS hospitals?
Yes, we do. I mean, in the UK, we don't. Obviously, the UK is the main provider of maternity care in the UK. So we do collect from NHS hospitals. We also have recently signed up with several NHS trusts as well, whereby they are willing to collaborate with us much more on the collection side of things and are willing to promote our service also within their trusts.
Excellent. Thanks a lot for filling me in.
Thank you.